MSc in Gerontology programme, which was brilliant. It was probably the best summary I could give to that. I work full-time and I study part-time. The programme was really well designed, and the thing that attracted me to King's was not only its reputation as a university, but also the way the programme was structured. I think it was favourable to part-time students, because sometimes that element gets neglected. Some of you may be thinking full-time, but for me it really worked well working full-time and being able to study. The range of modules as well, I think, were quite important to me. I liked the fact that there was a range of options. They had some core modules and some of the optional modules, and they ranged from biology to some more social sciences. That's the thing that I really enjoyed about the mix of the programme. It involved research methods, both which I found interesting, challenging, but interesting, really well delivered, and I think that is the other part of this. Sometimes people can go and attend lectures and look at online learning and stuff like that, but I think the staff and the way it's delivered was a critical part in helping my understanding of the research methods. I don't come from a mathematical background, and I'm looking at one of my colleagues at the back who tried to teach me statistics very well. I did do it.
Succeeded, Richard.
I did. I passed. Was never my forte, but I came in to the programme probably with more of an interest in statistics. But to be honest, I actually developed a huge interest in the qualitative research side, which if you'd asked me before, I would never have thought that would have been my thing. But again, skills that I have learned, and as part of my job now, I'm an occupational therapist by trade, but I have two roles. I work in the research department at UCL in North East London, and I also work part-time for the World Federation of Occupational Therapists. So, what I've taken from the programme, I think was really important to know. I did my thesis around dementia, the causes of crisis in dementia, which I'm now going on to publish in an academic journal with an impact factor rate of over 2, minimum, and which has been really useful, because actually the whole dissertation thing terrified me, but I think now seeing it develop and implementing what I've learned from doing that dissertation, not only in my day job, but also affecting and influencing patient care, which is fortunate with the role that I have in my day job. But it's enabled me to take a lead within the research team on qualitative research methods and focus groups and those kinds of things, which I developed as skills from here. I certainly think now I am far more able to read academic journals without sort of skipping all the statistical parts, and again, influencing what I do every day. I'm due to take over as Executive Director of the World Federation of Occupational Therapists in June. And I wouldn't have been able to do that if I hadn't have done this degree. My peers usually are MSc, PhDs, professors. I obviously have a far more operational role, but I think having the skill base and what I know from here certainly will equip me to deal with not just the management side of that role, but also the thinking. You know, gone are the days now when I open a paper and read it and just accept it, which I tended to do. You know, now I totally critique everything that I read.
But it hasn't made you a happier person?
No, I haven't moved anybody's nerves. Like, I don't believe everything you read. Actors and all of those things that operate in society. So that's one of the critical things that I've learned. And certainly having a degree from King's is prestigious, and people do comment on where I've graduated from. I've been invited to talk about my work that I've developed through the programme in other countries too, such as Japan and Norway and a couple of others. So again, it's stuff that I never expected to open so many doors, and it does sound very grand. It's a hard slog, and you have to work hard. It's not an easy ride. I don't think that it is, but it is well worth the effort, because I think, particularly with the gerontology side, it's not just one core subject. you're studying a whole range, and it just equips you with skills to develop that.
Sorry, I just wanted to just say something about how many hours it took outside of the lecture. I mean, how many hours you spent reading or working on the dissertation, or how well did it fit in as a part-time student to your full-time job?
Yeah, I think one of the things that we were very clear about at the beginning is that you've got to pace yourself, because if you leave it and start to cram, it will become much harder. Which I think I did. And I actually, one of the things I didn't mention is that I was ill for part of the course, and the staff were so supportive and beyond supportive, because I actually I was off sick for about 4 months from work. I got a huge panic about the programme and wanted to finish it, but the level of pastoral support and understanding within the team was great. So I suppose, in a way, going back to your question, was if you pace it, and you actually do generally pace it, it's not a slog. If you leave everything like a week before a deadline, you're not going to get able to do it. So I'd probably say, try to remember, 2 hours maybe reading an evening. I would do leisurely. If it was for an assignment.
Once a month, right?
After lectures, and that's the best thing, because obviously you go, it was we did usually 1 day a week. And did the reading then, it was far easier. So no, it wasn't too intense. And the dissertation, I think, the preparation for that, it seemed far more onerous than it actually was, because I was absolutely dreading it. And it was this huge big thought of writing 18,000 words on something. But no, actually, maybe I forgot. But on the whole, actually, might be really listening. And like I say, it's a very interactive way of learning as well. It's not just sitting there. There's workshops, there's labs, there's discussion. You get to know your people on your programme. Make friends as well. And that was an important thing, because we actually all helped each other out. So some people would actually go and get some batch of articles, other ones would get the other batch and stuff like that. And it was that shared learning which really did make a difference. And the personal tutor system. I knocked on many doors, many times, on one-to-ones, and you wouldn't necessarily get that on other programmes, I don't think, not listening to my peers in other programmes. You do feel like you have that sense of belonging almost. It's not as anonymous, really, as you might imagine.
Sorry, Scott, you wanted to say something?
Oh, just a question, if you've got time.
Yeah.
So did you say you're now in the process of publishing from your master's your dissertation? Which, so first of all, congratulations. That's fantastic. And I know as director, I mean, I encourage students to think about that early on, and that is, I mean, the reality is not everyone will go on to do that, because it's hard work. But it's great when people do it. So I was just wondering if you could say a little bit about the process of how you got from finishing the dissertation to where you are now.
Sure. As you mentioned, this is a lot harder, I think, trying to make the dissertation into a paper of 3,500 words max, and to have some impact in what you're writing, because obviously the dissertation is far more elaborate and going into detail. I work in a research environment, so it's my peers are very keen to support the development of staff into that publishing area. I don't know, to be honest. And like I say, I think there have been a couple of co-authors on it, which is helpful because there's a level of expertise to support that. But I was just talking to the staff about it, and they were saying if you need any assistance with that, if you're doing it on your own, then they'd be interested in helping, which is brilliant. And yeah, I suppose that the research I did, we got a phenomenal number of responses, which also helped to some degree.
Can you say something about what you did, Richard? Because I'm realising, although you're not, I think I was your personal tutor. But I actually don't
I think we all were.
This is that, sharing things, knocking on doors.
I don't know what you actually did for your dissertation.
We did a questionnaire which asked healthcare professionals, consumers, carers, people with dementia, and voluntary sector healthcare professionals and consumers and academics what they thought were the main cause of crisis and dementia. So we gave them a list of all the factors that can cause a crisis and hospitalisation. We asked them to pick the top 50% from a range of domains, and then that led to a ranking of the most common causes of crisis for people with dementia. And then we did the same with interventions. So we listed all the interventions that could cause a crisis and asked people to select if they thought it could prevent a crisis or be useful in a crisis, or neither. And we got 723 completed responses, which was interesting. And again, it was great because we had about 100 carers in those responses, and they all answered online. So there was lots of interesting things that came out of that work. And it was interesting. The main finding was generally that people with dementia and carers have a different view on what causes crisis than healthcare professionals, which is particularly important, I suppose, when we're thinking about what people may suddenly do, or what might send them to A&E. So, for example, incontinence was a huge factor for carers, but healthcare professionals didn't particularly like it.
Thank you very much.